Good afternoon, everyone. My name is Kimberly Kuhlman, and I serve as the Executive Director for the National Spasmodic Dysphonia Association. I just want to thank you for taking the time to join us today for this webinar. We know that daily life continues to be impacted by the COVID-19 pandemic, and many people are still under a shelter-at-home order, meaning essential services are open, but oftentimes physicians' offices are closed except for emergency procedures. So we know that your treatment options might be limited today or delayed. The NSDA has launched a series of these sessions to help focus on the issues like this that are impacting us. In addition to the webinars, we are also hosting online virtual support sessions on Saturday mornings at 11 a.m. Central. And we hope you'll also join us next Saturday, May 2nd, when we're hosting an online virtual symposium. A lot of the sessions will be pre-recorded, but we will also be doing some live Q&As. We also have an interview with Jamie Schmidt, the founder of Schmidt's Naturals, who has spasmodic dysphonia. Today is actually part 2 of a discussion. No worries if you missed part 1, you won't be lost, but we're going to be talking about vocal techniques to help manage the symptoms of spasmodic dysphonia and related conditions. Our speaker today is SLP Christie DeLuca. Christie is a speech language pathologist who specializes in assessment, treatment, and research in spasmodic dysphonia. She currently works as a clinical voice specialist in the voice program at Brigham and Women's Hospital in Boston. She has lectured for graduate and medical students. She has provided hospital in-service presentations on treatment for voice, and she's presented her research at conferences for both the NSDA and the American Speech Language Hearing Association, ASHA. Christie also has spasmodic dysphonia, which gives her unique insight into the disorder as a patient, a researcher, and a clinician. It's now my pleasure to welcome Christie.
Hi, everybody. Thanks, Kim. So I am a speech language pathologist and clinical voice specialist, but I do have spasmodic dysphonia myself. So I'm going to go through some techniques that hopefully will be helpful in terms of dealing with some symptoms, in terms of compensating for what voice symptoms that you might be experiencing right now. So, I know that right now is a very, very difficult time for many people in many ways, but to have a voice disorder, chronic voice disorder on top of that, and then the added layer of maybe having difficulty getting treatment right now, that can lead to some exacerbation of your voice symptoms. So hopefully some of the techniques I showed today, as well as maybe some of the ones that I showed last week, can help you kind of get through or cope with whatever you're dealing with right now. So like we mentioned, these webinars will be recorded, so you can go back to the first one if you want to see what I talked about in the first one, or you can go back to this one afterwards and view it. There's also handouts that will be posted too, so check out the handouts for some more information or more kind of detailed instructions too, to go back and to maybe have with you when you're practicing. Some of the handouts are more detailed, and then one is kind of just quick tips that I'll go through today, along with, it has some a link to some blog posts as well that have some more information, some more educational materials, or just coping strategies for dealing with voice disorders at this time if you're interested. You can also feel free to email me, so the email's on that handout as well. I can put it in the chat box. So if you have any questions, please feel free to either write in the chat box here, or feel free to email me afterwards. So I'll say the kind of caveats before I jump in that I said last time. So these strategies are not meant to cure any neurological voice disorder. So, I have spasmodic dysphonia. I still have my spasmodic dysphonia, but I'm able to use voice therapy strategies to help compensate and to help kind of manage and cope with my symptoms a little bit more. So it's not meant to take away your symptoms completely, or to get a perfect voice or to cure any voice disorder like spasmodic dysphonia or tremor, but hopefully it'll give you some strategies to be able to manage them a little bit better or more efficiently. The second thing I'll just say quickly is please make sure to be working with a speech language pathologist if you do engage in any of these voice therapy strategies. We want to make sure that you're doing the strategies correctly, that you're feeling what you want to be feeling when you're doing these strategies, and that you're really able to individualize them to fit your specific needs. So with those disclaimers, I'll kind of jump into today. I'm going to talk about mostly airflow and how to more efficiently use your airflow when you're speaking. So, you know, when we speak, our airflow is extremely, extremely important. So if I'm speaking and I'm not using much airflow, I might feel some strain. I might feel some effort in my throat. I might feel some inconsistent voice or more severe breaks. If I'm able to even out my airflow and use my airflow a little bit more efficiently, I might be able to better compensate for some of those symptoms. So I'll show you what I mean. So I can speak with, very little airflow, which would kind of be in my throat here, where I'm kind of pushing my voice, or I'm just kind of like letting my voice sink down here where it's rough. Both of those don't sound very clear. They sound strained or rough. They are very uncomfortable in my throat. So I can speak with very little airflow, or I can try to speak with a little bit more airflow like I'm doing now, where I'm trying to compensate for whatever symptoms I might be feeling in my voice by using my airflow a little bit more efficiently. So when we have any sort of voice disorder, especially something like spasmodic dysphonia or vocal tremor or MTD, that can definitely interrupt our efficient breath use patterns for speech. So it can make us feel like we're using more effort during speech, that we're pushing our voice out a little more, that we're running out of breath when we speak or getting short of breath when we speak. And so using this airflow can be a really efficient way to manage those symptoms and to get your voice to be a little more consistent and even, and to gain some more control. So what I'll show you is some flow phonation. So you guys can try this along with me. I can't see you. Nobody can see you or hear you. So I encourage you to try these strategies and see what might be helpful for you. So if you want to do this along with me, you can do this with your hand. You may have seen this done before. You can also do this with a tissue held in front of your face. Right now, I'm just going to do it with my hand, so it's easy for you guys to do along with me. So you can start with just getting some easy airflow. So I'm going to start with just air, so just breath and no voice at all. So I'm going to purse my lips and see if I can pretend I'm blowing out some birthday candles and really just feel a consistent, easy breath on my hand. Okay, so my lips are pursed. You can't hear me doing this. It's supposed to be silent. It's supposed to be passive, but I feel a lot of consistent airflow on my hand when I do this. Okay, even if you have tremor, even if you have SD or MTD, you're not engaging these muscles here. Your throat muscles are relaxed when you're doing this. It's supposed to be really smooth, really easy. You're feeling a lot of consistent, even breath on your hand. Now, if it's feeling really choppy, or if it's feeling not so consistent, you might be breath holding at certain points, or you might be holding tension maybe in your throat, or maybe somewhere in your chest, or maybe even lower in your abdomen. So make sure you're not holding tension anywhere, and try to just have this be really consistent and really even and fluid. Okay, now once that's feeling pretty even, we're gonna add some voice, because that's obviously the goal, to use the same sort of breath when we're speaking. So I'm gonna have you do a whoo sound. So it's gonna be a really breathy, easy sound, ideally. So you're gonna start with a little bit of breath flow and then ease into some voice there. So, so it's a breathy sound. You hear that breath in my voice. I also feel some forward vibration, because I feel that sound coming and vibrating my lips, but I feel that consistent airflow on my hand. Okay, so you should feel the same amount of airflow and a really consistent airflow as you did when you were just doing air. So if you felt like when you were just doing the airflow, you had consistent air, and then when you went to add in voice, it completely dropped and you don't feel that same amount of airflow, you're probably holding your breath or not using your breath as efficiently as you can be. So again, check to make sure that you're not engaging your throat when you go into this. So if I'm doing something like, whoo, I'm clearly pushing a lot there. You can hear that strain. I can really feel that. If you're kind of using a lot of your air at once, you're going to run out of air pretty quickly, and it's not going to be really even and consistent. You can also avoid taking a huge breath before you do this. So if you take a huge breath, and then you try to do that, you can tell that's way too much breath to be using, and I'm actually holding some tension in my throat when I do that. So try to release any tension, any of your throat muscles that are being held here, and see if you can get that easy, consistent sound. So I'm using about maybe 70% airflow and about 30% voice. So I'm not trying to make a super loud sound here or a very pushed or strained sound. It's really something that's supposed to be pretty easy and fluid for you. And we're going for this kind of increased breathiness, this kind of exaggerated breathiness that I'm demonstrating right now, not natural speech. We'll get there. Just feel that increased breathiness and how that can maybe decrease some of the effort or push that you might feel in your throat. So once that is feeling pretty good, just doing the who, we're going to try to bring it into some sentences. So you can try the sentence, who are you, with some of that breathiness. So again, keep your hand in front of your face so you can feel for that consistent, even breath flow. So, who are you? Okay, so it's a consistent, even tone. My breath feels really consistent. My voice feels pretty smooth and consistent there. I'm not doing who are you, right? Or who are you? That's holding my breath or using some tension in my throat to make that sound. Instead, I'm trying to release these muscles again and try to get a little more of that consistent, easy airflow. Who are you? Okay, now obviously this doesn't sound like real speech right now. We're going to make it sound a little bit more natural, but you can play around with how using that consistent, even breath flow can maybe make your voice feel a little bit more released or a little bit easier. If you're having trouble, again, feeling that consistent airflow, check for any tension. Make sure you're not holding your breath when you're trying to do this or working too hard to push the breath out. So if you're holding your breath, it'll sound kind of like, who are you, right? You might even try to do that while holding your breath to get a strong contrast. So try one where you're purposely holding your breath and you can hopefully feel a difference of that version versus when you're actually releasing and using that breath. So instead of having that squeeze where I'm breath holding, what if I try to actually release that on my exhale? Who are you? We're going to try to make it a little bit more natural, a little bit more towards speech. So you can try to add in some increase in intonation. So, who are you? Who are you, right? I'm still maintaining that breathiness, but now I'm adding a little bit more speech characteristics, a little bit more intonation to make it sound a little bit more natural there. You can try some other sentences here. So sentences with H's or WH's might be really helpful. So I know some of you might have difficulty with H's. If you have ABSD, see if you can still get your voice to be, or your breath to be really consistent with this voice here. So let's try a different sentence. How are you? How are you, right? It's still this kind of breathy voice. I'm not pushing, how are you? I'm not letting it drop, how are you, in my throat, but I'm allowing that airflow to be just easy and consistent. I'm maybe thinking about what it felt like when I was just flowing airflow without any voice and trying to mimic that same feeling where you're getting that really even, consistent airflow throughout the whole thing. Now, if you feel like that you do the first sound and then you just immediately run out of breath after that, so if you're doing, who are you, right, and then it gets really strained, you're not keeping your airflow consistent and you're losing a little bit of that airflow because you're pushing so much with that first sound. So if I use all my air in that first sound, who are you, right? I'm out of air by the time I get to the end of the sentence. So see if you can regulate that breath a little bit more by having it be a little bit easy and not pushing so hard on that first sound, but easing into that a little more. So, who are you? You can try some other sentences. So, who won the game? You can do who is Sue, right? all of this, you hear that kind of smooth, consistent airflow. Now, if you have tremor, if you have MTD, if you have SD, you might still hear some of those symptoms when you're doing this. The goal, again, is not to get a perfect voice quality. The goal is to get a smoother voice quality. So if you can get it to be a little bit more smooth, or if you can get a little bit more control over that, that's the goal. And that's what that breath flow and speaking with that breath flow will hopefully give you, is a little bit more control and ease. So, you know, this airflow can be really, really convenient to decreasing tension in your throat or decreasing any sort of effort or strain. So the goal is to bring this into how you're speaking day to day. So how do you start to implement this maybe efficient airflow, or maybe using your breath while you're speaking so that you're not speaking so much from your throat? So again, I can compensate for breaks by kind of speaking like this, where I'm pushing my voice out. Or I can kind of like let my voice hang down here, where I'm really not using airflow for either of those. Or I can let my voice be really much smoother when I try to change the way that I'm using my voice a little bit. Again, I'm still using that forward focus that I talked about last time, where you're trying to feel your voice being really focused up front. You don't want it kind of sitting down low in your throat here. You really want to still be speaking from here, from your lips and your tongue in a forward manner, but also now maybe implementing some use of that even consistent airflow. That can help too. So I'll talk about how this airflow can also be helpful for for sound-specific challenges. So for instance, if you have AB or AD, you might notice that you get sound-specific breaks. So you might have breaks that are specific to or more challenging after certain sounds. So for AD, for adductor spasmodic dysphonia, you might notice that so vowels after voiced sounds are likely going to be more difficult for you. So you'll experience kind of this strained, strangled breaks where your vocal folds are coming together and they're kind of squeezing and spasming when they adduct or when they come together. And so you might notice that vowels after what's called voiced sounds might have that strong, squeezed, strained break after it. And so voiced sounds are consonants or sounds in the English language that have voice. So there's voiced and voiceless sounds. So voiced sounds would be da, ga, the z, all of those have voice to them. They have sound when I'm producing them. Versus voiceless sounds, that would be something like sh, right? All of those are just different modulations of my airflow, but they don't have any voice to them. So if you have AD, the adductor type of spasmodic dysphonia, you're likely going to have a lot more difficulty with vowels that follow these voiced sounds, because that's when your vocal folds are coming together to make voice and they're spasming when they're coming together, leading to kind of that strained, strangled voice break. So I'll talk about AB too in a second, but if you have AD, you can maybe use some of this airflow that I just talked about to smooth through some of those breaks. So, you know, if for instance, you know that D is a particularly hard sound for you and you know that you're gonna break on the vowel right after that, maybe try to use some airflow to make that a little more even. So instead of something like dog, right? Dog, where I know I'm gonna kind of break on that and I feel it in my throat, maybe try to see if you can use some airflow to smooth that out. So dog, dog, right? I'm using a different form of airflow versus squeezing my throat to fight against the break. I'm releasing my muscles and trying to use some of that airflow to flow through that instead of fighting against everything that's going to just exacerbate my symptoms. So for AD, you might also notice that words that start with a vowel are often pretty difficult. So you might notice that they're called vowel onsets. So you might notice that, for instance, the word eat or apple might be really difficult because you're automatically starting from voiced. You're starting with your vocal folds coming together, and you might even be starting the word with a spasm there. So you want to see if you can use what's called an easy onset. So maybe ease into that word rather than starting from such a squeeze or strained place. So I can say the word eat, right? Eat, where I'm really, you can hear that strain in my voice when I'm starting the word. Or I can think about using some of this flow and ease into the word. So eat, eat, right? So I'm flowing into that word by using my airflow a little bit differently. So you can practice this. An interesting way to practice this is by imagining there being an H in front of that vowel onset word. So you can start off practicing with an H in front of it, and then we're going to gradually take that away. So if you do heat, heat, and then gradually take away that H and make it, still keep some of that airflow, but make it a little more natural. So heat, heat, right? So I'm still easing into my word with some breath, but I'm not starting from a place where I'm just squeezing my muscles to start that word. So then if you have, some of you might be familiar with the sentence, we eat eggs every Easter, right? That's a really tough one for anybody with AD. And, you know, that's a tough one even for me because it has all those vowel onset words. But what you can do is you can use that breath flow through that whole sentence. Use those easy onsets to help smooth that out. So we eat eggs every Easter, right? That's a little bit more smooth than if I were to do we eat eggs every Easter. Or if I were to break up my breath and do we eat eggs every Easter. If I'm breaking up my breath, it's going to be a lot harder to it's going to be a lot harder to feel that flow and to feel that ease. If I'm allowing my breath to carry through that whole sentence, it's going to be a lot easier for me to get the whole sentence out. And likely I'll have maybe less severe breaks or less severe tension in my throat. So you can use that to kind of almost have it help you carry the voice a little bit more. So for AB, you likely already feel a lot of breathiness in your voice. So you're kind of more breathy maybe, and you have breathy breaks rather than squeeze breaks that you have with AD. So for AB, for abductor, it's the vocal folds are spasming when they're coming apart and when they're transitioning from voiceless sounds into a vowel. And so again, those voiceless sounds are going to be the sounds that are silent with just air. So so those might be more difficult sounds for you, and you might experience a hello, that kind of prolonged breathy break after that voiceless sound. So same thing that I was just talking about with AD, just in a slightly different modified way. You're going to still want to keep your airflow pretty consistent. So you're losing a lot of air when you have those breathy breaks. But if you can keep your airflow a little bit more modulated and more consistent, it can help you maybe to control those breaks a little bit more or ease through the breaks so that you're not running out of so much airflow there. So you can try that. So a sentence like Harry hit the hammer is probably going to be pretty hard for anybody with AB because it's all voiceless sounds with the H's starting those. So use that airflow. So Harry hit the hammer. Again, you're still going to have those breaks that want to come up. You're maybe still going to have those breaks. But if you can smooth that out a little bit with airflow, that can often be helpful for decreasing the effort or at least having you get through that sentence with a little more ease. So those are some techniques specific to AB and AD. If you have tremor, that airflow is certainly going to help you as well. The more that you fight against the tremor, same thing with AB or ADSD, the more that you fight through those symptoms or fight against those symptoms, the symptoms are likely going to be exacerbated. So if I'm using more effort to get through the tremor or breaks, I'm going to feel that more in my throat, but it's also going to exacerbate my symptoms likely. Versus if I'm able to relax these muscles consciously, focus on the breath flow or forward focus to my voice, it becomes a little bit easier. And the symptoms are less exacerbated or less apparent. Same thing with MTD. So MTD, the whole purpose, so voice therapy can cure MTD, but MTD often is secondary to something else. So even if you cure the overlying MTD, if it's secondary to something like spasmodic dysphonia, you're still going to have the underlying spasmodic dysphonia symptoms. But again, the goal is to teach you different ways of compensating and more efficient ways of using your voice. So those can be helpful strategies. I wanted to touch upon something called sensory tricks. So you may have heard of these before. So sensory tricks are something specific to spasmodic dysphonia that when you're speaking in that manner of vocalization, it makes your symptoms maybe disappear or maybe be less apparent. So some examples of this are singing, speaking in a higher pitch, speaking in kind of a whisper voice quality, emotional speech. Some of you might notice that symptoms get a little bit better when you're speaking in this way. And that's because it's using a different manner of vocalization that typical speech is using. So you might notice temporary relief when you're in these different patterns. I would not necessarily recommend to speak in those patterns, and I'll tell you why in a second. But we can use different aspects of different aspects of each of those techniques to capitalize on what's helpful in each of those and maybe bring that into a more natural speech pattern for you that's helpful. So, many of you, I've heard many of you say that speaking in a higher pitch certainly helps. If I'm speaking way up here pretty frequently and I'm trying to always raise my voice way up here, number one, that feels pretty uncomfortable in my throat. I feel that push in my throat and that strain and that squeeze because that's not where my normal pitch range is. But also it just feels really unnatural to me, and it's something that I'm likely not going to use in normal conversational settings because it just doesn't feel good. It doesn't feel normal or natural to me. So instead, maybe capitalize on maybe slightly raising your pitch if you're really low or hanging out down in your throat, but maybe use some more intonation to reach some of those higher pitches, but without consistently straining to keep it up at this really, really high pitch that's going to eventually exhaust my throat and lead to some vocal fatigue. If whispering is beneficial to you, I've heard, some people say that whispering is really the only way that they can get a voice out or a smooth voice. Whispering can also be equally as straining. So if you're getting somebody to hear you, but only just whispering, I'm really pushing for my throat to try to get you to hear me when I'm whispering. And so I'm causing actually a lot of tension and strain when I'm doing that. So if you can capitalize on maybe using some flow phonation or just that easier voice with maybe some forward focus, that can help the voice be a little bit smoother or easier for you without necessarily needing to go in your throat for that strained whisper all the time. If singing helps you, you can use singing as kind of a vocal warm-up if it's feeling good and it's not causing you any strain. If singing helps, you can also use this kind of like sing-songy type voice in conversation. So you can exaggerate your intonation when you're talking, and then bring it back towards a more natural form of speech for you. So using that kind of intonation pattern is a great way to capitalize on the fact that singing might be beneficial, or maybe speaking at a higher pitch might be beneficial. What if we try to use more of that flowed intonation when you're speaking, and that can help you get out of your throat? So that could be the difference between me kind of like speaking in one pitch here, where it's really hard for me to get out of my throat there. Or what if I try to kind of release those sounds a little more and get a little bit of a different pattern of intonation? I'm trying to bounce my sounds a little bit. I'm using more airflow when I'm doing that. And I'm able to get my voice more up here, but more released and less in my throat. So those are some techniques that you can kind of play around with and see how they can be helpful. I will go through some vocal hygiene really quickly, and then, I'll take any questions if anybody has any questions. So vocal hygiene, I'll just go through some here. You can find more details on the handout too. I won't go through all of them, but you want to make sure that your larynx in general is remaining healthy and that you're taking good care of it, just like you would the rest of your body. So, make sure, first of all, you're well hydrated. If you're dehydrated or your tissues are dehydrated, it could lead to increased roughness or more strain and effort when you're trying to produce voice. So see if you can maintain about 60 to 80 ounces of drinking water per day is a good estimate, but make sure you're staying well hydrated. If you are drinking a lot of dehydrating substances like lots of caffeine or alcohol, make sure to balance it out with more water on the other side, or try to decrease the intake of those caffeinated or dehydrating beverages or substances. You want your voice to really stay well functioning, vibrate in a really efficient way. So we might as well do what we can to help at least indirectly there. Try not to push your voice a lot. Now, many of you might have to get your voice out with some extra strain. Try to use these strategies I talked about today and the ones I mentioned in the last webinar too, to get an easier voice without working harder to get that. If your voice feels tired, rest it. Just like anything else, don't push past that. You're just going to lead to more vocal fatigue or more tension or tightness in your throat. So rest it when it's tired, or try to reset it again with some of these techniques that we've been talking about. You want to really avoid inhalation of any environmental irritants, so smoke, dust, any allergens. Try to control for those as much as possible. You would really generally want to avoid smoking or vaping of any kind. That can be really damaging and irritating to your larynx, so make sure to stay away from those if you can. In general, you want to avoid, projecting or shouting over noise. There's healthy ways to project, and you can work with a speech language pathologist or voice therapist to help you develop those ways to project in a more noisy environment without all that squeeze and strain. But if you're feeling like you're in noise or you're trying to speak over other people, try to rest your voice, or really not try to yell or shout or project in an unhealthy way that's using a lot of these muscles. So those are just some brief general techniques. You can go to the handout to see some more techniques. Again, vocal hygiene is not going to take away any of your voice symptoms. It might make certain things a little bit better, or it might take away some things that are exacerbating some of your symptoms. Caffeine can certainly make any neurological disorder or neurological symptoms worse. So maybe play around with decreasing some of that, increasing your hydration, decreasing throat clearing, or putting extra effort into your larynx, and see how those might maybe have a small effect in terms of leading to maybe more less effort or a more consistent or easier voice quality for you. So those are just some helpful techniques. Again, use them as they're helpful. They're really meant to be individualized for each person, but you can start to play around with these. Really, ideally, you would be doing this with a speech pathologist again, but hopefully, I know many of you can't even get treatment right now, so use these strategies as they're helpful. You can reach out to me with any questions you have, or I'm happy to answer any questions right now. All right, so yeah, so I can type my answers. I can, if you guys have, I'm seeing a few pop up here. I'm just gonna open the chat here. Thank you, Mary. So throat massage. Yes, so laryngeal massage can be extremely helpful. I am not going to demonstrate that here because one, I can't feel your throat. I really need to be able to feel somebody's throat to make sure that they're in the right place and that we're kind of targeting the right muscles here. It can be extremely helpful for reducing tension. So if you feel like you're working really hard and your muscles are always really tight, these techniques will help to reduce some of that muscle tension, but it's also sometimes helpful to engage in some manual circumlaryngeal massage, which can really release release the tension manually. I would just recommend finding a voice therapist in your area. Right now, it's really difficult unless you've already worked on this before, because it's all teletherapy. So it can be difficult to do laryngeal massage through teletherapy. But once things are reopened, or if you've already worked with a speech language pathologist on it before, maybe reach out and see if they can continue to help you with that. Okay, so let's see. Forward focus. Yeah, so forward focus, I went over that more actually last time. So if you didn't see the first webinar, I would actually look at that one, because that I talked a lot about forward focus and forward resonance. Kazoo and humming in a straw, absolutely, yes, will help as long as you're doing it in the right way. You want to be feeling that strong vibration without any tension in your throat, so it feels really, really easy. I typically recommend, if you know you're doing it in the right way, doing it for, there's no limit. You can do it for as much as feels good. You can use them as reset techniques, like in between conversations, in between, phone calls or virtual sessions, to just kind of reset your voice and get it back into a resonant or more efficient pattern. Again, I demonstrated those last time, so if you want to look at how they're done, you can look at how they're done. And too little, I mean, if you're doing that, if you're doing them, once per day, might not do anything, or, 2 minutes per day, it might not really do anything for you. I would recommend at least, 10 to 15 minutes per day to really start to entrain that pattern. So you could do it throughout the day. Again, use it as a vocal warm-up in the beginning of the day. That's what I do. I do it in between my patients as just a vocal reset too. And it's also training your voice to maybe maintain that kind of some of that resonance, okay? Let's see. Okay, so finding a speech pathologist or speech therapist where you live. So the NSDA on their website actually has a great listing of individuals who offer services to those with SD. So you can check that out. It's on the healthcare providers listing. And now I believe there's an indicator as to whether those people provide teletherapy or not. So you can check that out. If you're having difficulty, I can try to, I know some people who are offering, otolaryngology services in locations, so I can try to help point you in the right direction if you're having difficulty. So you can feel free to email me, Christie DeLuca at gmail.com. But go to the NSDA website at the healthcare listing. They have a lot of providers that should be able to help you. Meditating and visualization techniques. That's a hard one. That is really individual, I'd say. Some people, I would say, find benefit to, overall experiencing less tension and kind of less stress. So, overall, if you're less stressed and you're holding less tension, your voice is likely going to be better. I can't comment on any specific research for meditation or visualization techniques, but if you find it helpful, there's no harm certainly in doing it. And it could be, helpful just in general to engage in de-stressing techniques because that will always certainly help your voice quality in terms of being less tense and less strained. Let's see. And one that is familiar, yeah, so in terms of the question of finding a provider, yes, that listing will also, it's all people who work with specifically spasmodic dysphonia. So, not all providers are doing teletherapy right now. So you can reach out to your office and see if they're offering teletherapy. And again, that listing should indicate whether or not those providers are doing teletherapy. Again, you can kind of combine what techniques are helpful for you. So pick and choose, maybe some techniques from last time or some techniques from this time. Again, if you're doing them and they're feeling like effort or work, they should never feel like effort or work. They should never lead to vocal fatigue. So stop if you're ever feeling that. And again, please find a voice therapist if you're finding that these are maybe a little bit helpful and you want to really learn how to do them properly, or make some tweaks or modulations that could be really helpful for you. A voice therapist is really the way to go for that. All right, so if there's any questions that come up, again, you can feel free to email me. I'm happy to help as I can. Yeah, I hope this was helpful for you guys. I'll just type answers to people who wrote questions to me individually, and then I'm doing another webinar in 2 weeks to talk about the psychosocial symptoms of dealing with a chronic voice disorder. So you can join me for that. I know, personally how difficult it can be dealing with a chronic voice disorder that comes along with lots of stressors and social implications and implications for jobs and relationships and all of that. So we'll delve into a little bit of a discussion and how you can kind of validate those feelings and cope with those feelings too. So if you're interested, join us in 2 weeks for that one as well.
Great, Christie. Thank you so much for such an informative webinar. We really appreciate it. And the handout that Christie mentioned is going to be uploaded to the NSDA website. The link is actually the first one in the chat box, so you can go there shortly. And then we will also, probably by tomorrow, we will have this recorded webinar also available so that you can review it again, because there was so much information that she covered. We hope you enjoyed it, and we look forward to seeing you all back soon again in 2 weeks with Christie. Have a great afternoon. Thank you.
Thank you all.